Okay, so for part two, outside of having many mental health issues, the main concern for Pacific Islanders is that Pacific Islanders rarely seek mental health treatment. In research, they found that Pacific Islanders use mental health services about one-third the rate of white Americans. And our own work has shown that there are many reasons for this. Number one is a sense of fear among many Pacific Islanders regarding treatment, but also that there is a sense of shame and embarrassment that is experienced when people enter mental health services. There's a sense that mental health issues should be taken care of completely in the home by family. So by seeking treatment outside, there's a sense of shame, a loss of face, and if the information ever gets out into the community and everyone finds out that a person is seeking treatment, there can be social rejection. In fact, that is one of the main issues I keep hearing time and time again, is that Pacific Islanders are very concerned that when they seek treatment, their business, their information will get out into the community and create a sense of loss of face for themselves, but more importantly, usually for their family. And so treatment is therefore very scary for people. But one of the things that we absolutely need to do, especially during the time of COVID-19 crisis, is we need to start breaking down barriers around talking to people about mental health issues. We need to make it easier to lean on each other as well as professionals, such as myself, when people are feeling stressed or having difficulties, because that is a normal, expected reaction to both a national crisis as well as just day-to-day activities. We all experience depression and feelings of sadness. Many of us get worried and stressed when times are tough. And instead of dealing with this by ourselves, it's important that we seek treatment. Specifically with COVID-19, there are several concerns that we have. First of all, this period of time is a national, well, really a global public health crisis, the likes of which we have not seen in over 100 years. So it is okay to be stressed right now. It's stressful because COVID-19 is devastating, it hurts people, and it's killing a number of people throughout the world. What is of concern for clinicians such as myself and organizations such as OSA is that many Pacific Islanders are disproportionately impacted by COVID-19. Many Pacific Islanders, for instance, work essential jobs in food service, healthcare, such as nursing. They work in these very difficult positions where you cannot social distance, so the risk of exposure is high. For instance, many Pacific Islanders in the South and the Midwest, they work in meatpacking factories. And meatpacking factories are actually the number one source of COVID-19 outbreak in the country. And so what happens is that Pacific Islanders right now are both getting infected and dying from COVID-19 at among the highest rates of any racial group in the US. In data that we have pulled together, just in California alone, the rate of COVID-19 infection among Pacific Islanders is 467% higher than the rate for white people in California. When you look at a place like Arkansas, where a lot of work is being done right now around COVID-19, the infection rate for COVID-19 among Pacific Islanders is 500% greater than the rate for white adults in Arkansas. And that's just rates of infection. When we look at who is dying from COVID-19, Pacific Islanders in California have a death rate that is 2.5 times greater than the general population in California, while Pacific Islanders in places like Arkansas, they are dying at 4.5 times greater rate than the general population. So there's a lot of experiences that people are going through during COVID-19, and it is okay to be stressed.